Good morning, everyone. Welcome to an episode of Coffee Break with CARD, La Hora del Cafecito's new sister show. My name is Lourdes Quinones, and I would like to welcome you to the show. Come on in. Coffee Break with CARD is a program dedicated to all those in our community who are living with autism, to their family members, and to all those who support them. Come on in, join us, and let us know if you're drinking your cup of coffee with us. We'd love to say hello to you. As you know, November is a month in which we celebrate with family and friends the many blessings in our lives. And we celebrate around the subject of food. So in today's program, we're going to be talking with Janie Broshous, certified speech and language pathologist at the John Hopkins All Children's Hospital, who will be answering our questions related to issues associated with feeding and autism. And those things can often impact our loved ones' nutrition, as we know. So join us. We have a lot to talk about. Welcome, Janie, to the show. We appreciate
Good morning.
it. Good morning. All right. But before we get started, let's start by introducing you to our coffee break hostess for today, Olivia McDonald. Good morning, Olivia. Okay. So unfortunately, our other hostesses, Jasmine and Maggie Aldana, are busy this morning. They had other compromises this morning. So we send them our love and we hope to see them next time. So it's Olivia and I this morning. We're going to be interviewing Janie. We want to thank Janie again for being here with us. Thank you for taking the time to be here. It's so wonderful to have us join us. Anyway, as you know, I am a pediatric physical therapist as well as a special education teacher. And over here at CARD, I am a consultant assigned to the primary age group. Olivia McDonald is also a professional in the field of public health, and she is a CARD consultant also assigned to the primary age group, just like me, as well as being the mother of a beautiful baby boy with a head of hair on him. I'm telling you.
He's really more a toddler now, but we'll pretend he's a baby.
Yeah, mine are still babies and they're older. Anyway, and she's also the sister of a younger brother diagnosed with autism. So welcome, Olivia.
Thank you, Lourdes. Good morning, everyone.
Yes. Anyway, so before we get started, let's review the rules by which we want to adhere before going on the air to make sure that we keep a safe environment for all of us. Remember to keep an open mind, a positive attitude, and use respectful language. All right. So, Olivia, do we have anyone to say hello to this morning before starting?
We do. I want to say good morning to Mark.
Oh, good morning,
Marianne, Denise, and Philomena.
Oh, hello, Philomena. Number one fan. Anyway, welcome. Thank you for being on the show. Anyway, awesome. All righty. So in today's program, like I mentioned, we're going to be talking to you and also talking with Janie Broshous. She's a certified speech and language pathologist and feeding therapist at John Hopkins All Children's Hospital. And she'll be answering our questions related to the feeding issues associated with autism, which can impact our loved ones' nutrition. So join us. We have a lot to talk about. And again, thank you, Janie, for being on the show. We really appreciate you. Welcome. So why don't we start by you telling us a little bit about yourself?
Yes, ma'am. Good morning. Thank you for having me today. I'm very excited to have an opportunity to tell you about my passion. I am a speech pathologist at Johns Hopkins. I have over 30 years of experience in this field. I actually went into speech pathology because of my passion for autism specifically. Oh, wow. And so I just feel really blessed to have had so much experience in private schools, public schools. I've served as a special education director, worked in public education and special education my entire career. I'm certified by the American Speech Language Hearing Association. And then more recently, I'm also a autism specialist, certified autism specialist. And currently, I'm super excited to serve on our Johns Hopkins Psychology Department Autism Streamline Clinic, where we have the opportunity to diagnose autism, offer resources and support for families when they very first get that diagnosis and are needing of guidance of what comes next.
That is so important. And you know, your professional background and mine are very much similar in our trajectory. Except I didn't get started with autism. I kind of stumbled on that. And once I fell in love with it, I fell in love with it. Then I became very purposeful. Awesome.
So, I went ahead and shared the information for the Autism Center in the
Great.
comments.
Yeah.
Can you please let our audience know, so what is feeding therapy and what does a typical feeding therapy session look like?
Okay, and I love when people ask me that typical question, because we know there is nothing typical about autism or the children we serve. The scope of eating difficulties are likely going to be a factor based upon age, sex, gender, cognitive, adaptive functioning, severity of behavioral traits. Research now indicates 50 to 90% of children with autism also have some difficulty with feeding. These can include ritualistic, rigid eating patterns, restricted food interests, food aversions, oral sensitivities, pica, where they eat non-food items, and the behavioral concerns. So let's just talk about a couple of those difficulties first, because that's what we're going to address typically in a feeding session. First, sometimes children with autism are going to have difficulty with the sensory properties of the food. They may have sensitivities to how the food is presented, the look of the food, the color, the size, the shape. Others might have aversions to the way the temperature or the smell of the food tastes. Some others might struggle with the texture. We have children who will only eat crunchy, will only eat pureed, will only drink their food. Sometimes it's the taste, whether it's sour or bitter or salty. They can have aversions to sensory stimulus in their environment. So feeding therapy is going to have to address those as well. Some children will only eat if a particular video or music is playing in the background, or only eat when there's no distractions at all in the room. So those are going to be things that a feeding therapist is also going to have to consider, because obviously when we recreate the home environment in a clinical setting, we do the very best we can. But again, it's still in a hospital setting. And so feeding therapy is going to be play-based. It is going to be fun. It is going to be exciting. We're going to go rapidly to keep attention, so that we can address some of those other things. Another common issue that we have to learn how to address is sitting at a table, or we start in a high chair very often. Sometimes this is difficult because mealtime is such a social activity, and children with autism often have impairments in that social communication. Maybe eating and being in a social environment is not motivating for your child. It's not rewarding, and they maybe don't see a point to it. Finally, many of our children are so active that they have a hard time sitting still. And it doesn't matter what we offer them, they're not going to sit still for feeding time. So those are going to be things that we're going to address. So that said, in skilled feeding therapy, a trained therapist is going to work with both you, the parent, the most important piece to the feeding puzzle, and your child to develop the skills required at mealtime. So first, a comprehensive feeding evaluation is going to be the most important to establish a baseline of where is your child at right now, so we can set goals and objectives based upon what's important to you. It does no good for me as a therapist to say your child's going to take 4 bites of broccoli if your family never eats broccoli and you can't stand the look of broccoli. I'm going to be doing extensive interviewing through an evaluation process of what are your goals as a parent, what is going to make a substantial impact in your life at home or when you go out for dinner. What's going to make the most impact for you as a family? And every child's different, so we are going to have a different approach every time in therapy. Sometimes our focus is going to have to start with oral motor strength and function. In the cases of low muscle tone, lack of chewing, taking food from a spoon, or continuing to have, if we see in very young children, we continue to have a suckling response to eating or drinking. Those are things that have to be addressed in oral motor therapy. Another approach might be sensory issues, such as a child's aversion to chewy foods, or maybe meltdowns during mealtime due to them getting a particular food on their face or in their mouth or on their hands. Sometimes that can elicit a meltdown moment. Sometimes kids will only have a certain number or a handful of foods that they're willing to try. And so we have to use chaining, which is successive approximations or baby steps to expand that food repertoire. Treatment is going to be very, very child dependent. One thing I want to mention is with regard to feeding therapy, specifically the oral motor part of it. Because there can be such a defensiveness, that can also lead to problems with teeth brushing or visits to the dentist. And oral aversions can be very specifically treated doing oral motor therapy by a speech therapist to improve the oral hygiene and address those behavioral concerns that often come out of those trips to the dentist. So we like to try to help with that as well.
I know this is so important, and parents who are living through this, I'm sure, are right there with you. They're like, "Yep, sounds like my kid. Yep, that sounds."
Yep.
So I'm sure. So with that said, and really briefly, I'm going to ask you, can you give us some of the most most common feeding struggles that you see with patients who have autism? And
absolutely. And I know a couple of those things I've already mentioned. We know that the diagnosis of autism is going to include those repetitive patterns of behavior, insistencies on sameness, rigid adherence sometimes to a routine, hyper or hyposensitivity to any kind of sensory input.
Yes.
So because that's common in autism, they are going to have those same rigid behaviors when it comes to food and mealtime routines. Sometimes children with autism, they'll eat a good sized meal and they'll be gaining appropriate weight, but because they're only eating certain foods or certain shapes or certain brands of food, they may have a very low nutritional value, and the parents can become very concerned about the nutrition intake that they're having. I frequently hear about the white or brown diet where parents are like, they'll only eat chicken nuggets, French fries, pasta, grilled cheese, cookies. So that's a very common thing. Yeah. Sometimes I see in our autistic children, they have such a high activity level and poor attention or poor joint attention, which we know is characteristic in autism, that they will refuse to sit during mealtime. And so grazing becomes the pattern, and parents are just so happy to get anything into them that they'll allow them to be up and moving about at mealtime, sometimes even following them around, trying to get food in their mouth just to know that they've had something to eat. And maybe they have to put a video on in order for them to eat. And then the parent's struggling with, oh no, I know I'm not supposed to be doing screen time so much with my child, but yet I need them to eat. And so those are frequently concerns that we hear when parents come into our office. Another factor often seen is constipation, because when you're only eating a certain number of foods, very often not including fiber from fruits and vegetables, we can have constipation. And some of our families are supplementing with nutritionally valuable drinks like Pediasure, which are wonderful, but then they have to struggle with the constipation part. Some of our kids are, of course, are more severely involved. Pica is a very real concern in many of our children, where they're going to eat non-food items. They're eating rocks, dirt, coins, hair, but they don't want to eat the nutritional foods. Sometimes too, we may have trouble transitioning from a bottle to finger foods. It's not unusual for me to have families where the child is 3, 4, or even 5 years old, and they're still taking a bottle because they won't drink from a cup, or they don't want to eat foods beyond liquid and crunchy. But you all know that just like there is a broad spectrum of characteristics in our autistic children, the same thing is found in feeding difficulties. We see a very broad variety of difficulties in our children. So if, most parents, the number one thing they struggle with is, what is the difference between picky eating versus when do I seek help? When do I, seek a professional? And I say always, always, always choose to reach out to that professional, because if there's not a concern, we will tell you, but we want to help alleviate those fears that you might have as a parent. And at Johns Hopkins, I am here at our St. Pete location, our main campus, but we do have several outpatient centers across the area. And you can contact our hospital, and I think y'all are going to put up the website and the phone number if you want to contact our speech and language pathology department about feeding concerns.
That is so wonderful. It is true. And I think that parents would appreciate that. Olivia, you want to ask the next one?
Yeah, I just went ahead and shared that information.
Okay.
So what kind of professionals can do feeding therapy, and how can parents find a qualified provider?
Okay. All right. That's a great question, because that's where we need to start. I've had, families and friends reach out to me over the years that ask this question. And I will say sometimes there's only minor concerns, like they're eating a variety, but boy, they just like to see them eating a few more fruits and vegetables. And that happens. And sometimes the resources that you can find on the internet are valuable, but I always like to point parents to a couple very specifically designed for this. One is mymunchbug.com. It's a fabulous website by a gold standard professional in my field. Her name is Melanie Poddick. And that's a valuable resource if you're just a little concerned and just want to expand a little bit beyond their set fruits and vegetables. Other articles you can find are on the Autism Parenting Magazine website, published by the Autism Speaks organization. Those are great resources for parents who only have a slight concern. But if you're struggling still with that picky eating versus is it truly rising to the level of what we diagnose, which can either be a pediatric feeding disorder or an oral phase dysphagia, or sometimes both, I strongly encourage parents, let the professionals decide. Some parents are simply at their wits' end. Feeding time is a battleground. And I'd encourage you to reach out to a trusted professional. Most frequently, it's a speech and language pathologist. It's going to be your best course of action to address both communication frustration, because that is an issue, is communicating about food, communicating what you want, teaching the child to communicate about what they do and don't want, so they have preferences and choices as well. Also, an occupational therapist can be an invaluable point of contact for you as well. Most importantly, regardless of who you contact, I want to encourage you to reach out to somebody with experience, both in feeding and in autism. Many qualified professionals work with children with autism for communication. Many qualified professionals work with children for feeding. But when you combine those two factors, you're looking at a totally different scope of practice. And so I would just encourage you to look for somebody, whether it's an SLP or an OT, make sure they have professional experience and are totally comfortable dealing with behavior issues as well for both feeding and autism. So one thing about speech language pathologists is, like I said earlier, we can address those oral motor concerns. We specifically are trained in oral motor development, poor chewing, poor cup drinking, oral weakness, poor coordination that often comes along with feeding difficulties. Also, obviously, as a speech pathologist, I'm going to address communication. I can't turn off my language therapy brain while I'm doing feeding therapy. So your child's also going to get a great deal of language and communication therapy during a feeding therapy session, which is going to be play-based learning. And then occupational therapists, they're going to be able to address the feeding difficulties from the sensory component and the ADL and self-feeding component, and using the utensils and hand-to-mouth coordination, sensory behaviors that are often interfering with autism. Because you can affect hygiene and potty training and gross motor movement and play. So I always say too, ideally a team approach in a facility that has multiple professionals, to include a speech pathologist, an occupational therapist, psychology. Sometimes we're pulling in nutrition, and then of course always the child's primary care physician. Okay, so as far as looking for a qualified provider, I often get asked, how do I know? How do I know what's going to be right fit for me? I can get on Google, but how do I find somebody? So I just want to throw out a couple of questions that I think are so important for parents to ask when they're looking for a provider. One of these is, how often have you treated a child like mine? And be specific. Ask them, how much experience do you have in working with feeding problems, specifically with children with autism? If your child has behavioral concerns, say, are you comfortable working with these behavioral concerns? There's many good therapists, but not everybody's going to be comfortable. Another question that parents can ask is, how are you going to include me, the parent, in the therapy process? There is no one more valuable to the process than the parent. There is nothing that a professional does that is magic that we cannot train you to do. It does absolutely no good for me to work with your child 1 or 2 times a week, say, oh yeah, they did really good, I'll see you next week. How is that going to help you as a parent when you're serving them 3 to 5 meals every day during those 7 days that I'm not seeing your child? So including the parent in the process, you've got to ask those questions. How are you going to train me as the parent? And if you're not comfortable with that therapist's answer, then you need to keep looking. Another question is, how often are you going to reevaluate? How do you determine progress? How do you set goals and objectives? And will you let me know what those are? Typically, we are going to be reevaluating every 6 months, but therapy is diagnostic in nature. We are going to be looking and thinking and revisiting every goal, every session, and communicating those to you. We want you to share your expectations, because if you are not sharing your expectations and you have this in mind, but your therapist has this in mind, and those expectations don't line up, sometimes that can cause unnecessary conflict in your relationship with your therapist. Share your expectations. What's most important to you? Do you want your child to just stop eating only white foods? Then let me know, and that's what I will address. Do you want your child to gain weight? Is weight for height ratio important to you, and has it been a concern? Do you want your child to lose weight? Be sure and address that with us. Do you want your child to eat a larger variety of fruits and vegetables? If we are managing and agreeing on expectations early in the therapy process, everyone is going to benefit in the long run.
Wonderful.
And I know you kind of already touched on some of this already, but is there kind of some like framework or standards of the signs that a feeding therapy is necessary?
Absolutely, yes. So all children are going to go through a developmental period of picky eating. That's just statistics and research that every child can have that and go through it, and it's considered totally typical developing. When children are developing that level of independence as toddlers, they begin to also want to determine what they eat, just like they want to determine what we play with. That's mine. They're going to want to determine what they eat. So
my son is going through this at the moment.
yeah, and your child is probably typically developing that independence, and we want to encourage that. Between 12 and 18 months, all children are going to go through normal periods of independence and picky eating. However, the need to seek professional help can be determined by just a few factors. One is your child significantly below weight level and the expectations for his age for height? And that can be determined by your visits to your pediatrician when they're weighing and measuring your child and they're not in the percentile rank that your pediatrician or even you are comfortable. That is a concern. Sometimes children will not eat at least a few foods from each food group. That would be a concern. If you find yourself using the words only a lot when describing what your child will eat, that can be a concern. For example, my child only eats white foods. My child only eats starches or crunchy foods. My child only drinks milk. They only eat sweet food. They only eat fast food. If you're talking and you're using that word only often, then I'm going to really suggest that you have an evaluation. The other is if your child's not getting the proper nutrition, the proteins, the vitamins, the minerals that can be found in a variety of food groups instead of just one group. Another reason to seek out help would be if your child is developing strong food aversions to textures, aversions to temperatures, aversions to the feel of food or the appearance. That would be a red flag. Sometimes your child might have an intake of a much younger child. For example, if your 3 or 4-year-old is still drinking only milk in a bottle, but eating very limited finger foods, that would be a concern. Significant behavioral outbursts at mealtime or when food is presented to them. Mealtime should be fun and pleasant and not stressful. If it's not, it's time to reach out to a professional. If you're unsure, like I said earlier, if you're unsure, go ahead, schedule that evaluation, ask your pediatrician for that referral. Let us decide. If there's not a concern, we're going to be the first to tell you. We're going to celebrate with you. Your child's doing great. If there is a concern, we're going to tell you. We're going to say, hey, let's work together, and I think we can make some progress.
Excellent. So let me ask you something. What are some of the things that caregivers can do at home to support your work as you do the feeding therapy? And in other words, that home exercise program that.
Right. Absolutely. Okay. So here's my heart as a professional. My job and my passion is to take the pressure off of you, the parent, to decrease the mealtime battleground atmosphere. Parents can have such feelings of stress and fear, anxiety, sometimes even anger and frustration when dealing with a child's feeding difficulties. This is so understandable when we are putting pressure on ourselves to be that perfect parent and making sure that we're meeting our child's needs, particularly in proper nutrition, because we all know that nutrition significantly impacts behavior. And so what I really, really want is for mom to be mom, dad to be dad, not have to worry about you being the feeding therapist too. We want to transfer that burden to the therapist. We want to reestablish those peaceful meal times for the family. This is a slow, gradual process. So what we do ask from parents is that you just be really patient with us and with your child. When we start therapy, we typically start with a 6-month plan of care. So in a 6-month time period, that's a lot of sessions. And so we're not going to go from A to Z in a month. 6-month plan of care is typically what we start with. Now we can adjust that as we need to make that longer or shorter and reevaluate, but please give us time to make those gradual changes. We always strongly encourage parents to read the resources we give them. I give out handouts, and sometimes I think that those handouts go home, they get stuck in a folder, they're in a car. But if you're reading those and you're looking and taking in that information and then coming back and say, hey, I read that handout, but I have a question about X, Y, and Z. It's just during a feeding session, we can't get all that information into you as a parent. So when we point you to a resource or ask you to watch a video or we give you a handout, your part is going to be to follow up with that outside of our sessions. We also are going to talk to the parent about what they're comfortable with. So for example, if I ask you to do sensory food play, getting messy, touching food, offering the child a variety of time to touch and play with their food, apart from any pressure to eat it, and I ask you to do it 1 time a day, please try 1 time a day. If you can't, talk to me about that. If a parent does this consistently, it's going to help decrease the touch, the smell, the sight aversions. If the parent doesn't like the child to be messy, and doesn't value that as an important strategy, that's really going to limit our progress in
That's
therapy.
so funny that you should say that, because that's such a Latin thing too. Like, oh no, let's not get that clothes dirty or the carpet dirty.
Right.
I was like that with mine. It's like, oh no, we can't. I just knew. Oh my God.
I frequently see, so I always have the parents feed the child first, and I see, and so I'm watching kind of what's going on. And do they put the spoon in and then take the spoon and wipe away the food and make everything neat and tidy and then wipe away their hands after each bite? Then that alerts me as a therapist, okay, we're going to have to get mom or dad a lot more comfortable too in allowing this food play.
Yeah, you said something else that triggers. I always say this thing: it's not a routine until it becomes a routine. It sounds so obvious, but with children with autism, that's the thing. You just said you have to do it at least once a day. Again, children, one of the characteristics of autism is that adherence to routine, right? So
Absolutely.
It's not a routine until it becomes a routine, right? So by
Right.
introducing it every day, eventually it will become a routine.
Yeah, it's that strength. It's that hurdle that becomes that strength.
Exactly. Yeah, exactly. So just because and I tell teachers all the time when we do trainings, it's like, it's not going to work. Of course, it's not going to work the first few times. It's not going to work for a long time. Expect it not to work for a long time. If it's not working, we're doing it right, because it's not a routine until it becomes a routine.
That's right. And that leads me to my last thing as far as parent involvement is, because we're often dealing with behavior management strategies. We all know it takes time to change those behaviors. When you are rigid in your behavior pattern, it's going to take some time. And so sometimes we have to include in our training high chair sitting, table behavior, decreasing the use of rewards to get sitting behavior, but rather just expecting it. And so we have a lot of behavior management strategies that we want the parent to do at home as well. And then we'll have more time in therapy, if we're not dealing with the behavior management, to do the food chaining. We ask that parents just help provide the items that we need in therapy, be consistent in bringing what we require. here at Johns Hopkins, I may have a cabinet full of different kinds of baby food, but if your child's 4 or 5, that is not what we're working on. And so I'm going to provide you with a list of items, whether it's the utensils, the cups, the plates, the food. Please be diligent in bringing that in, because our sessions are going to go smoother if we have everything we need. And then the main thing is just parents following through with that home program that we're going to give them. It's going to be really imperative to therapy success.
Yes, exactly. And you mentioned that, you know, out of 24 hours, you're with them 1 hour a day. Out of 7 days a week, you're only with the child 1 to 3 times a week, depending on the plan of care, right?
Right.
So, the rest of the time is parent time. So making sure that the parent is included in that session, and that they following through with the plan of care, that's ideal. Thank you so much for sharing that. My last question to you then is, what is the last thing you would like to tell our audience? What's a takeaway for them?
Okay. We've talked about a lot of good information. As far as therapy and finding a therapist, we want it to be a good fit. If it's not a good fit, keep looking. Be honest with your therapist. When she asks you questions, please just be honest. We have heard it all. There is nothing that is going to shock us or surprise us, or it is a no judgment zone when it comes to therapy. For example, if you tell me you're still giving your child Pediasure 8 times a day just to get something into them, I'm going to say, okay, so where would you like to see us go from there? We need to know that information. I'm not going to judge you. If you're still giving them milk in a bottle instead of a cup, don't tell me they're taking a cup if you're giving them a bottle every few hours. Just let me know. I just want to know that. We're not going to judge you if you're only giving them spaghetti and that's all that they eat. I'm going to help you walk through that process. We just want you to be honest with us. The other thing I really want to make sure, the personality fit of your therapist and your child and the interaction is important, but that's going to also be impacted by communication. So regarding communication and therapy, we're going to include you. If you're not being included in your child's treatment sessions, ask to be included. Ask specifically about what home plan can you be doing. Lastly, please be patient with the progress. Like you said earlier, it is a process and it's a plan of care to be adapted and changed as we need to go. Be patient with yourself. Don't beat yourself up if you don't get to that week's homework for therapy. It's okay. It's okay. Life happens. I'm a mom. I understand that in an ideal world, you'd be doing everything that we ask you to do, but that's an ideal world and we don't live in that. Parents have a million things to do on a daily basis, and the demands of a parent, any parent, are great, let alone a parent who's also struggling to meet the needs of their child with autism. So what I always tell parents, I said, do today what you can do today, because tomorrow's a new day. More than anything else, your child just needs to know that you love them, you accept them. Your love and acceptance is not dependent on what they eat, where they eat, how they eat. You love them all the time. That is the most important thing.
Wonderful, wonderful. We always like to finish a show with a very positive note to give hope to parents, because it is a hard day for most parents on any given day. Life itself is, can be full of challenges. And so anything to keep them on a positive note. So thank you for saying that. And also we like to tell our audience that your services are available for.
Yeah, I went ahead and shared information in the comments about, if they want to learn more, if they have contact.
Yes.
To go ahead and follow that information in the comments.
Wonderful. Yes, it's great to know when we have found great therapists. I know for a fact that it's when therapists are great to all therapists are wonderful, but some are very gifted. And so, especially like you mentioned, pediatrics is a specialty as well.
Yes,
Not
ma'am.
everybody can work with children. And so people need to know that about themselves. Therapists know that. So that's why some of us go into pediatrics and others don't, right?
Right.
Anyway, so wonderful. This has been wonderful. So thank you for being here. Thank you so much. I'd like to thank Janie and also Danielle Cachu for bringing us all this information. It has been a wonderful month. Last time we had Samantha from Johns Hopkins, a nutritionist. Well, so thank you so much for bringing us this wonderful information to Johns Hopkins, All Children's Hospital has been a wonderful resource for us. So if you haven't seen those shows, be sure to go into our YouTube channel, CARD-USF. There will be available there, if not on our CARD-USF Facebook page. They're there to make sure that you have them available. Yeah, if we can hashtag them also. Or
I just did that.
You're ahead of me. Okay. All righty. So also, do we have any comments before we go?
No questions, but comment from Mark saying that he's loving this conversation.
Oh, wonderful. Where is that at? I had seen it before. It's somewhere in here. I know we have had a lot of, there it is. Posts. Is it this one? No, that's All Children's. It's this one. Thank you, Mark. We appreciate it. I'm glad you're enjoying it. All right. Okay. So thank you again. We're going to have to do this again, maybe in another episode, Janie. We can do maybe how to go about maybe introducing the children in the kitchen to work.
Yes. Oh my gosh. There's so many opportunities for parents to include their children in the mealtime process.
Yes. Let's do it. Let's do that for now, next year. Okay.
Okay.
Yes. Wonderful. So you heard it. Okay. So anyway, we're almost at the end of the show, but I didn't want us to leave again without thanking you, Janie, for being here. And I'm going to keep you for that one because I'm very good at all those how-to shows and in getting the life skills and children involved in the kitchen, making that time around feeding time a positive moment for parents. And also wanted to remind parents that next month for the month of December, we are going to, December the 2nd, going to be interviewing Stacy, how do you pronounce it, Olivia?
I can talk about it. We're going to be interviewing Stacy Hoagland, who is the president of the Autism Society of Florida, and she's also a parent of an adult son with autism and a special education advocate. And she's going to be talking with us about a lot of great information regarding advocating for your child's education, but specifically also there's been a number of questions about data or outside evals and how about the process and how to help use those to get services.
Yeah. Well, so it basically collecting data at home to document progress or the need for services. And then on the 16th, we're going to be talking about organizational skills and how to create those data banks to document those progress towards meeting therapy goals. Okay, so be sure to join us in December. And again, just to let you know, November 5th was our Autism CARD's third annual Arts in the Park event, which was fabulous. So I want to thank all the exhibitors who took the time to be there and provided some wonderful classes and activities for participants. I've already posted some of those the classes. So I hope you have been enjoying them on our Facebook page. And so thank you. We hope to see you next year. And that brings us to the end of the show. But I didn't want to leave without asking you for a final favor, is to please go into that link we're going to be sharing to let us know how we're doing. If this programming, it's something that you value and you would like for us to continue to come into the air and bringing you this type of information. This is the way that we can justify the time that it takes us to put together this type of programming and to be here on the air with you. If you've done it before, we still need you to do it again every time we go on the air. So thank you, thank you, thank you. We'd like to stay on, all right? So help us stay on. All righty. So, okay, so that gets us to the end of the show. But don't forget to give us a like, share this video with those that you know can benefit from this, and meet us here every other Friday at 10:45-ish. Share a cup of coffee with you as we spill the beans on important topics related to autism. But until then, we want to wish you goodbye.
And hot coffee.
See you next time. Thank you. Have a great weekend, everyone. Bye-bye.